54. And here's some updated information. So as we were talking about earlier, you are lying down with your back on the exam table, dressed in the gown. And then here, recovery from stroke-induced left-sided weakness. That's going to vary for everybody, but you were at the restaurant 7 days ago and experienced the left-sided weakness, which resulted in your fall and the fracture of your wrist, which is now immobilized for 6 weeks in an ACE wrap. So I'm assuming they would add on more stuff as far as immobilization is concerned, but just for our simulation purposes, your wrapped wrist will be the immobilized wrist for 6 weeks. And then this is your initial OT evaluation. So this will be the first time the student is seeing you after getting all the medical information from your stroke and whatnot. So, and then as everything else is, you can't move your wrist with the left-sided weakness and have the left-sided weakness. Otherwise, everything is normal. Behavior is normal. Even for this, you don't have to be, even though your chief complaint is a little frustrating or you're giving it in kind of a frustrated manner, you're not unpleasant. You're not having to worry about, being in a certain mood for the case. So you can just respond as your normal, lovely, bubbly selves early in the morning. So, what to say if the student is going to be asking you, hey, can I see you just kind of flex your wrist a little bit? Can automatically just right off the bat, it hurts too much to move it. I don't really want to do that. Is there any other tests we can look at? But if they're trying to ask you to move your wrist, that would be a no-go. So you could just say it hurts too much to do anything. And the students will pick up on that. They're not gonna try and keep you in pain or push you to a limit that you're not ready for. And especially as first-year students, I would imagine that would be pretty traumatic for them to try and push you to a space that you don't want to be. So, yes.
Or, besides that, should you just say the doctor told me not to immobilize? Or not to.
Yeah, they'll have the orders for the immobilization. So if they do persist and say, well, I really want to see the range of motion you have with your wrist, that's a great line, Tammy. Just like, actually, the doctor said to not move it at all, so I'm just going to follow doctor's orders. Yeah, and I don't think they will broach that. I don't think we'll need to get any power dynamics for that. So, and then as far as the movement is concerned, when you get to those halfway points, that's as far as you can go. Should the student ask, can you push it any further? Nope, that's as far as I can go for today. And again, this is a 25-minute encounter, so it's not like they have an hour to assess, look at things, then try and get you to do the same tests over and over. This is initially just kind of their first test on what you can do. Big one here, kind of opposite of what we do. If the student leaves the room before helping you lay down again, will you help me lay down? So essentially the student needs to leave you in the position that they found you when they first came into the room. And that's, again, just for their own practices and whatnot. They shouldn't be leaving any patient in any other state unless specified. So if they come in and they see you lying down, that needs to be the position that you end the encounter in. So nice little tuck and turn down service there for the end of your encounter. And Nancy, to your question earlier, you are able to go from lying down to a lying down position to a sitting up position without student assistance, but let the student assist if they offer to. So if they say, I need you to sit up, and they just kind of stand there callously, you can go ahead and do that. You might throw in a few whimpers like, but no, I'm just kidding.
Well, I would probably roll to my right side and sit up from my right side, whether I'm facing the wall or the center of the room. So
that is totally fine. Yeah.
So that's probably what I will do if they're not going to help.
Yeah, that's a good call. And again, you can always display that, or you can always say that in your evaluations. I would have appreciated if you would have assisted me in sitting up. It would just make me feel more connected to my medical provider if you did that. Not necessarily, I would have appreciated if you would help sit me up. I told you I had left-sided weakness. Just let the student know that you would appreciate the assistance getting up, not necessarily, hey, you should have picked up on this and you didn't. Their faculty will help them with those aspects, so. And then the muscle exams.
Faculty's not gonna be in the room.
What's that?
Faculty's not gonna be in the room.
No, they're not. With the OTD faculty, they do come in here and are watching live on some of the encounters. And then the students, they have a really kind of close relationship, so they can sometimes grab a student, after their SOAP note and maybe discuss on hand. But yeah, nothing you have to worry about for that. So.
How many OT students are there?
For
There
first year, 30?
25 for this class. So that's why there's 2 tiers.
Okay.
So the first tier, one of us will be playing in the one room.
So we've got the exams here, and we'll transition to the video of what this is going to look like. But you're going to have your grip and your pinch strength. And this is just the dynamometry, is a valuable tool in assessing muscle strength, identifying weakness, and guiding rehabilitation strategies, providing quantitative data that helps the clinical decision making and monitoring progress in strength-based interventions. So it's kind of neat. The students for these kinds of exams, they can get a kind of a real measurement in real time of what they're looking for, as opposed to asking you a lot of questions and trying to figure out differential diagnoses of it could be this, it could be this, it could be this. Hey, you're just laying it all right there for the student. Left-sided weakness, had the stroke, had the fracture. So they're just going to be monitoring those aspects of the encounter, which is kind of a nice thing. It's always nice when you get to kind of just come in and portray and play a case, as opposed to looking at all the little nuances and intricacies of what could be wrong with you. So they're going to be doing the palpation of your muscles, including shoulder, elbow, forearm, bless you, wrist, hand, pelvis, hip, knee, calf, and ankle. So a lot that they're going to be looking at. And if they don't necessarily do all of these tests, that's okay too. They're going to get their readings from what they can in the time frame that they're given. And of course, we wouldn't want the student to be rushing through and trying to get everything. We want them to take it at their own pace and get the correct readings of what they have. And then, of course, that goniometry, that's the measurement of the joint range of motion. So using that goniometer, it's going to measure the angles accurately. So you might see them pull out a little plastic ruler that's got kind of a little hinge on it that they can measure what they're looking for as far as your upper and lower extremities are concerned. It's going to track that joint movement, and it's going to provide, again, that quantitative data that will assess the joint limitations that you have. It's going to track the progress for the rehabilitation. So again, once they get these measurements, they would write that down, and then in their follow-up visit, say maybe 6 weeks from now, they would test that again to make sure that, hey, you've made some progress as far as your immobilization, or as far as your OT is concerned. But again, this is just the initial reading that they're getting for today's visit. Any questions on any of the exams? So here's your doorway information. Again, everything that the student needs to do is listed under those candidate instructions. With the 5 minutes to review the case, we will go ahead and just have you in the room that whole 5 minutes, so you can just kind of prepare your mind to get ready for the thing. Last year it was 10 minutes, and with some of the other OT cases, would have you wait in the lounge and then we'd send you in. But for this one, it's just going to be standard procedure of, patients, please make sure your room is set up properly, and that'll be your cue to head in and lie down and get ready to go. So, but this is all the information that the student is seeing there. So again, you're in the inpatient rehabilitation center, not the hospital per se. And everything else that'll be on them to figure out. And then let's go ahead and transition really quick to the video of what we're going to be looking at today.
Can I ask a quick question?
Yes, of course.
How long will we have to write our notes? Will it be 30 minutes or close to 30?
They've got 20 minutes for their SOAP note or for their note documentation. So I would say,
So they have, oh, hang on, that's second year's turn. No, that's first year's, sorry. Working on both things. They'll have 5 minutes of chart review. So you guys, we won't actually start recording until right before the encounter starts. So you'll have from the time that they leave the room, if they get done early, or if they go to 25 minutes, then you will then have from that moment until just a little bit before. So actually what might be easier, let's have everyone do evaluations in the lounge, because that way I can, whoever of us is coordinating, recording and getting you in place, we can tell you when to head to rooms so that you know to stop documenting and to go to rooms.
Okay.
So we do actually have it where you have in timing at least 25 minutes or a little more.
and just 2 evaluations that you're doing.
Yeah.
So one for your first student, one for your second student. So
Okay.
should have plenty of time. All right, so this is the video that Dr. Bluchek made last year, just to kind of show how the evaluations will look. And this is Dr. Summerfield. These are both OT professors here at the university, but I will go ahead and play this. Why is there no sound?
Oh.
1 second. That was it.
No, but we probably need to.
It's kind of hard.
You can have that, yeah.
They need to feel like today.
Like you're saying. Like you said, the pillow too.
Thank you. Thanks,
It's like, we want to so bad, it just, unfortunately, it's too quick to turn around for us. I need you. It's too busy.
Thank you for volunteering to be a standardized patient for us. But what I'm going to be doing is just doing this quick video to show you what our students are going to be doing for assessing the upper extremity and lower extremity for this case. So within this case, our patient has left-sided weakness. So this video is kind of mirroring. So this is her left side. This is her right side. So the left side is going to be the weak side. So left upper extremity, left lower extremity. So left arm, left leg. Our students will enter the room and ask some interview questions. So just very basic interview questions that you have the script for. After they do the interview question, they will do a what we call an upper extremity screen. So they have to go do a screen of the motions of the upper extremity. So generally speaking, when we do that, the student will ask you to mimic what their motions are. So if I were the therapist and Emily here is our patient or the SP in this situation, we would ask her, I want you to follow with me along with what you're doing. Okay. So the left side is going to be weak, and this is generally what it's going to look like. So I want you to raise your arms up overhead like that. And that left side is not going to be able to come up all the way. Okay. Now I want you to raise your arms out to the side. And same thing, that left side is not going to be able to come up as far. Okay. I want you to bend your elbows for me. Okay. Because you have the fracture on the left side, we don't want the students doing motion on that left side. They can do shoulder range of motion and elbow, but they shouldn't be doing anything with the wrist and hand. So if they ask you to do wrist and hand motions, just say it hurts too much and I can't do that. Okay. Touch the back of your head for me. Touch your low back for me. Okay. So you see that left side has all that weakness. And so that's what it's going to kind of look like. You can do about halfway or so, and that's just kind of what we're looking for. Okay, so about halfway is fine. The student will also might ask for you to do on the non-affected side, so the right side, to do the wrist motion. So can you bring your wrist up and down, turn your palm upside down here, and then make a fist and open up. So the right side is full range of motion, full strength. So that side should not have any deficits. This side is going to show about 50% weakness. Okay. So from there, after they do this, they're going to do the specific goniometry measurements. It's going to vary by different students. Some of them are going to have shoulder, some of them are going to have elbow, some of them are going to have lower extremity as well for the knee, the hip. And so we're looking for about 50% of that range of motion for that left side. So when I go to measure the shoulder, we're going to use this, what's called a goniometer here, and the students will sit or stand next to the patient, standardized patient. And if I say, can you lift your left arm up straight forward and over your head, you want to go about 50% of the way to about shoulder level. So they're going to measure. Can you go a little bit higher for me? So right about there, and that's what we're looking for. Okay. If I ask if the student asks, I want you to bring the arm out to the side and overhead on that left side, try and get it up. I want you to bring it up to about 50%. So a little bit higher for me, Emily. So about there is what a 50% will look like. Okay. So they're going to measure that here like that. Same with elbow flexion. So bending the elbow on that left side, halfway is about here. So you'll come up to about there and they can measure it. If it were to be asked to do wrist or hand, anything wrist or hand related, just say that it hurts too much and you're not able to do that. Okay. So this is going to be a contraindication. So that's something the students have to pick out based off of the case that you're not able to do wrist and hand range of motion. Okay. They're also expected to do goniometry on the opposite side. So on the right side. So if that happens and they want to go up overhead, that one will be full range of motion. So all the way up and overhead. So the student will measure that appropriately, just like that. If they ask you to go out to the side and overhead, full range of motion on that right side here. Okay. Bending the elbow, full range of motion. If it's anything wrist related, so wrist is full range of motion. Anything hand related, making a full fist or thumb coming across, full range of motion. Okay. If it's anything lower extremity, so hip or knee, so they would have you on the table here. So I'm actually, on the left side. So if it were hip related for the left side, and they have you bring your knee up towards your chest to flex the hip, you'll only go about halfway. So right about there. So they will measure it like here. And then if it's knee range of motion, going from straight to about halfway would look about like that. Okay. So the students will measure it like this. Same with the ankle. If they ask for the ankle, same thing about halfway. Okay. The right side for those will come up all the way up towards the chest like that. To do hip, to do the knee, they will bend all the way like that. And the ankle will go in full range of motion of the ankle. Okay. So again, just that left side will be 50% that range of motion. Okay. The next thing that they'll do, so after that, they will do what's called manual muscle testing. Okay. So Emily, if you could set up for me. So with manual muscle testing, it's the same. You're going to portray what we call a 2 out of 5 strength. So what a 2 out of 5 strength looks like is the students will ask you to go through the full range of motion first. And then from that range of motion, they will determine what position to put the SP in, or the standardized patient in, to fully test the strength. Okay. So for example, for the right side is going to be full range of motion. So they will have full strength as well on the right side. So I will ask Emily, can you lift your arm up overhead? You'll go through that full range of motion on that right side, because that's normal. You'll come back down halfway, and they'll test that strength halfway. So here's where they will push down on your extremity, and you got to hold that full resistance here. Okay. Same thing if they ask you to bring your arm up to the side and overhead. Do that full range of motion, come back down halfway, hold it there, don't let me push you down, and you will hold maximum resistance for that. With the elbow, bend the elbow full range of motion, come back down halfway, don't let me push you down. Good. Same thing with the hips, the knee, the lower extremities. It will be full range of motion for that initial goniometry, and then, or for that initial range of motion, and then when they resist, you hold that maximum resistance. That's on the right side. On the left side, we are portraying what we call a 2 out of 5 muscle strength. So what a 2 out of 5 muscle strength looks like is you can't go the full range of motion when asked. So when I do the muscle test, the muscle test is separate from the goniometry that we did earlier. So they will still have you go through that full range of motion. So Emily, can you lift that left arm up overhead? And they will see that you can't go full range. So that left side is weak. It's not gonna go all the way up, okay? So you should be going about 50% of the way, not all the way up overhead. Okay, that's the indicator for the student to see that, okay, it's a 2 out of 5 muscle strength. Now I need to do a different position to test that muscle. And what we call is gravity eliminated. So they put you in a different position. So for this particular motion, I'm going to put Emily on her side. So Emily, could you go on your right side for me? And so from here, I'll have her on her right side. They will support that arm and ask you to do the same motion. So Emily, can you lift your arm forward and overhead? And you can go about 50% of the way there too, okay? So it's the same test, just in a different position, but same thing, I want you to do about 50% of that range of motion, okay? Same thing if it were something, like, could you sit up if it was something like the elbow? So if I'm testing the muscle strength of her left elbow, I'll say, Emily, can you bring your palm up and bend your elbow? You can only go about halfway. And from there, they should see, okay, well, you can't go the full range of motion. Now we need you to go into a different position. So the student will direct you into that different position, and you'll do halfway. So this one would be on a tabletop. And I'd say, Emily, can you bend your elbow? Same thing, go about halfway in that second position. Okay. So always think about halfway for the motion. And then they will not, on the left side, they should not resist your motion, because you are a 2 out of 5. They won't provide resistance. On the right side, they will provide resistance, and that should be full strength anytime. Full range of motion, full strength on the right side, about halfway on the left, and they won't resist you, okay? If they try to muscle test that wrist or the hand, again, tell them it hurts too much and you can't do that. Okay. The last thing that they will be testing, some students may be testing this, some may not, and it's called grip strength and pinch strength. So we have what's called a dynamometer. So the students will give this to you, and if they try to give it to you on the left side, just say again, it hurts too much. I can't bend that hand. But they should be testing the right side. So you'll squeeze as hard as you can, and that's just your full range of motion or full muscle strength for that grip strength, no different than what your normal grip strength is now, okay? The pinch strength is very similar. So it looks like this. It's just a smaller version, or it might look something. I can get this one out. Very similar version.
Not the most OT effective packaging
Looks
for
like
that.
this, okay? So same thing. If they try to test you on the left side, say it hurts too much and I can't do that. When they go to test you on the right side, you can give the full amount of strength for that left side. Okay. What's that?
The right side.
For the right side, sorry. The full strength on the right side. No, they can't do it on the left for the pinch strength. I apologize for the mix up there. Okay. So again, to recap, left side is about 50% of the strength and 50% of the motion, but they should not be testing the wrist or the hand because you should say it hurts too much. On the right side, you have full range of motion through all the motions and full strength, which looks like maximum resistance when it's added. Okay. That pretty much sums it up from there. They might have to ask you to retest it if they mess up one or two. They might go back and retest it, and that's okay for them to do that. Just do the same thing for that test.
Okay, so you see there lots of stuff happening on your right side. Everything is normal there. On your left side, that's where things are kind of getting a little jumbled and disconnected. I'm just gonna plug this so we can.
So what does weakness feel like? Is it a heaviness? Is it it doesn't hurt?
Right, that's a good question. I think for our purposes for this encounter, that weakness is essentially just you not engaging your muscle strength for that. So it's as they were showing, actually this is a good time we can all kind of practice this from our seats here. So everybody show me your right hand or your right side, just full range of motion as far as that. And then also on that note, if this is your full range of motion on your right side, that's okay. If you have a shoulder injury or something going on there. But if that'll be your 100% on your left side. So show me what 50% of that would be going up. So if this is 100, this would be, for me, this would be 50%. So yeah, kind of looking like our, not philately, but our flag bearers there. And then for the dumbbell kind of curl, so on your right side, that would be your 50% or your 100% there, excuse me. And then for your left side, I would imagine that would be about as high as you can go.
And we wouldn't be making a fist, right?
Correct, yeah, just essentially bringing it up to there.
It seemed like when she moved, every time she needed to use her shoulder. And I don't know if that's part of what we're.
And that's something we can ask
portray.
when Dr. Bluchek comes up.
Do they need to sort of help themselves with the shoulder?
Yeah, we can ask that because that's a good question.
And I think too, yeah, even for the physicality of that, as you're not having the full muscle strength in here to do that even even to the halfway, I would imagine, yeah, your body would try and kind of compensate. And as you're trying to put in more effort into that, yeah, your right shoulder might dip a little bit as you're trying to, yeah, essentially compensate for the weakness in your left side. We'll get a qualifier on that, but I think, yeah, for physical purposes, anytime you use that left side, show some of that strain in your right to show that you're actually putting in that effort to try and get that arm or wrist where they need it to. The same for the range of motion. Since they're not having you stand up, so disregard my gait belt comment, because I would imagine this would not be a safe thing to do for a patient with left-sided weakness. So it sounds like they're either gonna lie you down to test that. So again, with your right side, everything would be as normal. For your left side, laying down. Switch over. So for that left side laying down, that would be about as high as you can go. Kind of letting it just hinge there on the back of your heel and moving it down. That would be normal for right. And then since your feet are going to be in this flex position, it would just be basically kind of pushing just a little bit to get your left side, your right, you're pressing that gas pedal, you're good to go there. So.
And we'll have you guys all practice this. So, we'll have you do your normal so that you can figure out what your normal is. And then you can figure out what your half would be. So
Absolutely.
That'll help in your mind. If you feel what normal is, then think, okay, what's half of what I just did?
Mm-hmm.
Will they do the resistance on the left side?
Yeah. So they won't be, once they establish that you have that 2 out of 5 strength for your left side, as it showed there, he was applying resistance and saying, okay, like in other tests, like push against my arm or don't let me bring your arm down. With that, they shouldn't be doing any resistance on your left side. So if they are, it's just if they do that and they ask you to hold up, just let them push you down with whatever force they're using, because you wouldn't be able to resist anything at 2/5 of your strength there. Good question. And yeah, like Melinda said, once we get through this presentation, we will practice our physicality here in this room. I originally had it to where we could go to an exam room to practice this, but with all the testing going on, we're just gonna have to be nice and cozy in here today. So any other questions on any of the left-sided weakness or any of the tests that they're going to be performing? And again, would you be doing this with your left wrist? No, correct. Yes. So they will be asking you to do stuff with your right wrist is fine. As the video showed, if they offer you the pinch or the grip strength, and they say, "Can I see it with your left hand?" Oh, it just hurts too much to do anything. Okay, well let's check out your right side. So, and again, for their comparison, at least it would be grip and pinch strength would be at 0. You've got their numbers for your right side. So hopefully in 6 weeks when they do this test again, they will see some improvement, or at least that you're able to do the pinch and the grip strength.
The video showed the ace bandage was all the way up here. Is it gonna be just up to the wrist and the hand? Or?
It's just going to be to the wrist and hand. I don't know if Dr. Summerfield is wearing like a special piece of equipment for that, but last year it was just the ace bandage just wrapped around your wrist and hand area. And then, of course, with all of this, you still will be giving that feedback to the student. It is a little more brief than other areas, so we. So essentially, you're only looking at these criteria for your humanistic, so your verbal, nonverbal, listening skills, professionalism, and physical exam organization. Notice they don't have empathy there. Since this is such a physically driven case, obviously we want them to have that bedside manner. We want them to respect what you can and can't do. And we want them to, let you know that I'm glad you're here so we can start these tests. But it's not like they're coming in cold and calculating and not communicating with you. You can still think about aspects of your empathy for this case, but you're not necessarily grading the student on that empathy. Same with like the nonverbal skills. So you're starting off lying down. Hopefully a student is coming in and positioning their body to where they can see you, where they can kind of look at you, not necessarily standing back and doing the whole introduction while you're lying down, looking straight up at the ceiling. Hopefully they're coming in and making their presence known, and using those softer tones as far as that nonverbal skill is concerned. Your listening skills, making sure that they are hearing you when you say that, yeah, things hurt. My left side hurts. It hurts too much to do anything with my hands or wrist on my left side. So hopefully they're taking that into consideration and they're not asking you time and time again, well, how does your left side feel? Or can you do this for me? Hopefully they'll pick up pretty quickly that if you say no to one test, you're going to say no to all of them, at least for your left-hand side. Professionalism, making sure that they are treating you with respect, especially in this state of vulnerability that you're in as far as having that left-sided weakness. And then the physical exam organization seems pretty self-explanatory in the sense of are they testing everything that they need to in what seems like a good manner that's not having you sit up and down constantly or, oh, I forgot to do this. Can we have you go back? And with them being first year students, I would imagine there's going to be a lot of verbal communication on what they want you to do for the physical exams. As we saw in the video, hopefully they are demonstrating first and foremost with you alongside you as you're doing these tests. If they were to just say, okay, go ahead and raise your arm for me as high as you can. Which arm do you want me to raise? Or if they're again needlessly kind of going through the same test without moving on to something else, or at least to compare your right and your left side. That's where you're gonna draw a lot of that information for your physical exams. That reminds me of Jim, whoever has that tone. It reminds me of Jim in the office. So. And then you do have your, would you return to this healthcare provider using the yes, no's, or maybes. So of course you will have to give an answer for any statement that you're going to give. So if it's a yes, I would return because I felt you listened to my problems and helped me form a plan for my treatment. No, I wouldn't return to this office because you did not address my concerns and did not look at me once while taking my information. And I might return because while I felt confused by all your medical jargon that you used, I also felt at ease when you explained what might be going on in a way that I can understand. So you're going to have to give those answers there. But again, with just these 5 aspects and would you return, I can imagine your evaluations will be easygoing. It's still the standard practice of at least 2 to 3 needs improvement comments for the whole evaluation. So if you do find yourself with time at the end to maybe go in and fill some other comments into the students, that will definitely be helpful. I would encourage you to try and get in at least 1 comment per category with this one, since it is a shortened evaluation process for that. With this, just again to kind of help you concentrate on your evaluations. Should be 2 areas, but again, physical exam and verbal communication are going to be kind of the crux of this event. So essentially, we want you to focus your comments there first in physical exam organization and verbal communication. And then after you have filled in those categories, start to think about the other criteria and any comments you want to give to the students. But for them being first year students, these 2 categories are going to be some of the more important ones that they are going to take those comments from you as a patient and apply them to future encounters. So again, as we talked about for physical exam organization, are the students Determining the appropriate precautions and contraindications for the goniometry and muscle testing, as it said in the video. If you're establishing that your left wrist is in too much pain to do anything, hopefully they are not asking you time and time again to test that side outside of range of motion. But if they're keep handing you the grip strength or the pinch strength, and you constantly are saying, well, it hurts too much to do that, then they're not really taking in a lot of that information, or they're not taking in as much of that information as they should. And then as we see here, that contraindications, that's going to basically show that, hey, my patient told me that they're having that left-sided issue. So I really need to be focusing on that when I write up my plans for them, or when I think about any future testing that I want to see with them, and not necessarily forcing the patient to show some sort of measure of what they can or can't do there. And then the verbal communication, are they speaking with you throughout this encounter? Are they communicating what they want you to do as far as the physical exam is concerned? Are they showing you what they want to see? Are they asking this, I'm going to do this test to see if we can gain some information on this aspect of your life? Because again, they're wanting to make sure that as the patient overall, you are able to go out and still function as normal as possible during this time, during your wrist immobilization, because they're concerned about when they send you out to go back into that real world, are you comfortable in what you're able to do, and not necessarily fearful or not getting out information to them that they can relay to the medical team as well, to say, hey, just want to let you know my patient talked to me about this, and we established that left side is a no-go. So I want to make sure that is honored, that they're honoring what you were telling them as far as the communication is concerned. So.
Question.
Yes.
If I had a perfect student for a physical exam, they would give me the results of all my exams. What would that sound like?
That I don't know off the top of my head, since I'm not versed in that. But as far as the results, I would imagine that they would be showing you the goniometry like measurements and saying, so here's where we see you at right now. Here's where we want to see you, obviously like a straight line or like the perfect angle. And this is where you're at. If Jim were here, he could probably explain that a little bit better, but we can ask that to Dr. Pluchak whenever he comes in to see like what a perfect student communication would be for that. So
I'm wondering if we'd hear like 2 out of 5 or something.
what's that?
Like what it said in the script, 2 out of 5, 3 out of 5.
Well, hopefully for you, they'll explain, here's
What they've been.
what a 5 would be, here's what you are, to be a perfect, they do need to make sure they're speaking in a way that a patient will understand.
Not that it can't happen, because the level of studying that these students are doing beforehand, they could very much come in and just knock this out of the park. I would imagine with it being first year students and then this being their first time with a patient, there's going to be some missteps. There's going to be some areas of improvement, but always something to keep an eye out for. And if you do get that perfect student, we will definitely let the OTD faculty know to watch that one. So. Yes, Marty.
So they are not gonna be giving us any plan or really talking about any activity at home. This is just an assessment. Is that true?
Correct,
And
yeah.
just kind of, this is the current situation.
Mhm.
And then, how do you anticipate they would wrap up the assessment?
Good call, or good question. I would imagine that they would wrap it up in some regards of, thank you for coming in and performing these tests. I know you've had some left-sided weakness, and I know some of this might have been difficult for you, but I'm glad we got some indicators of what level you're at as far as your strength is concerned. They might also suggest some things that you can do at home, some like simple exercises to help get that weakness taken care of. But yeah, for all intents and purposes, no plan, no legitimate follow-up. I'm going to see you in 2 weeks, or I'm going to see you. Because if anything, they should be at least saying, I'll see you 6 weeks from now, because that's the doctor's order. That's the surgeon's orders from your wrist immobilization.
And since we did play this one last year, when we get done with the slides, we can pull up Jim actually was a patient in one of the rooms, so we can pull up his video and let you see how an encounter went, just so you have an idea of what they're going to do. Now, the one thing I will say, having flipped through some of these just to find, we'll make sure that your leg extension is up, because I noticed that for some reason last year it was down on all of them. I'm not sure why, everyone's feet are like hanging off. So we'll make sure that the exam table is fully in a laid position. But we'll show that since we do have that video from last year, and I think that'll help you guys feel a little bit more comfortable with what's going to happen.
Yes.
Instead of them saying, we'll see you in 6 weeks, it would seem like they're in a rehab facility. So wouldn't they be scheduling like to come in every day, or
Probably.
twice a day, or
Yeah.
Or
whatever
physical
they do?
therapy.
Just know that for this, because you aren't looking at the wrap up in your evaluation, we aren't going to worry about what the student specifically says in that regard of, oh yeah, I'm going to come this many times, or, you know,
Right.
they should be closing things in a professional manner. You are gauging them on professionalism, and to have somebody just get done doing exams and walk out of a room, you know, that wouldn't be very professional.
Right.
So look at the ending more that way of, are they ending it in a professional way versus what are they saying to me? You know, we aren't looking at a plan or anything like that for this one. So don't worry about how they are ending things word wise. Just as long as it's a professional ending, that's really the important part.
So would we even expect them to say, I'll see you again soon?
They might, yep. Cause yeah, with OT typically it's not a one and done. So it's, again, being first years, their first time putting together a full encounter, their first time seeing you. We are not looking at the semantics of how are they ending and things like that. We're really looking at how are they communicating with you? Are they communicating in a way that makes it clear for you to know what they're asking, what they're wanting you to do, what they're explaining to you? You know, are they defining terms? Because right now they're probably still more medical oriented. So this is one of those points where we're going to start shifting them a little bit more to the patient orientation of, don't forget, you're learning all these medical things. Make sure you speak to your patient in a non-medical way so they understand. So we're looking at that. We're looking at, are they keeping you safe, and are they asking or offering to give you assistance for things, demonstrating those sorts of things. That's really what we are looking at with this. We are looking at, how are they interacting with you? Are they making it where you can understand them and know what to do and how to do it, and those sorts of things. So overall professionalism, overall communication, are they listening to what you're saying? You know, when you say that you can't do something, are they listening, or are they saying, well, go ahead and just try, you know? Obviously they aren't listening to you if they say something like that. That's why you don't have all the categories for this, because we're not focusing in depth on everything.
We still expect them to come in and wash hands.
It's a good question.
That is a very good question. And we will ask that one when Dave comes, because I can't remember if that was an expectation of this one or not. Because they aren't doing exams where they're touching bare skin. So, yeah.
It is in the evaluation under professionalism. It lists on our chart.
Yeah, and that's because our humanistics is a general one and we can't really take away from, but we can definitely ask if that is one of the criteria for this one. I will add that to the list of questions that I'm writing down.
And then to someone, I forget who asked it earlier, but as far as professionalism is concerned too, again, this is their first time with a live patient in the room. So sometimes we can see a lot on mannequin side, this kind of nervous laughter that comes with the situation of, oh, okay, well, this one we're making sure that they're taking the simulation seriously and not just kind of breezing through it and maybe giggling at some aspects. You know, we still are expecting them to be medical professionals for this. So always something to keep an eye out for as well. Since again, with other events, they've been kind of working with their peers and say they mess something up on a test. Yeah, you can giggle and laugh at it because it's just the two of you, but there shouldn't be any sort of implication of something being funny to them as far as the test is concerned. So always something to think about there for professionalism. Just some reminders for this event, just like we do with other events. We want to make sure that the students are leading the exam and asking you to perform exactly what they want to see, and not necessarily being all over the place and saying, I'm going to do this, and oh, I forgot to do this, or I'm going to do this. And if something isn't clear to you as far as the student instructions, make sure that you're documenting that. But just go off of what the student is telling you in the room at that time. Also, with this case and the physicality of it, I just want you to communicate any discomfort clearly to the student. Because like I said, this is based off of your normal movements and your 100% versus half. So even if you're on a right shoulder and the student is having you raise it a bunch, and I don't want you to continue to put yourself through any pain or any discomfort for that. So after they just let them know that that's kind of tender as well. If something is hurting you, or if they're doing something that is causing you any discomfort, again, that's a bit rough, is the universal sign to all of the students here to reassess and reevaluate how they're asking you to perform an exam. Accept assistance when offered. And again, this is going to be a big one too, because with the physicality of it and in your weakened state, the student should be offering an abundance of assistance when asking you to move in any part of the encounter. So if they do offer it, take it. Make sure that you practice saying yes to students, because I know from time to time it's like, can I help you to the chair? No, I'm good. I'm fine. This one, we want you to just be wholly in need of assistance for anything for that. Ask clarifying questions when necessary. And again, this is if a student maybe breeze through a physical exam that they're wanting to do and say they didn't give communication clearly on what they want you as the patient to do, you can ask that qualifying question of, can you explain again what you're needing from me? And with that, I wouldn't necessarily transfer that to your evaluation, saying like, I had to ask you to restate what you were saying to me. Just, I would follow that along with, or just in the moment of, I'm not quite sure what you want me to do. So ask that communication, or ask the student to communicate that clearly to you. But of course, we want you to stay enrolled throughout the encounter. So once the student leaves, just give it a beat before you stand up, or before you get up and move to the lounge for your evaluation. Because again, the recordings are going, and we try and stop them as best we can right as the student leaves the room. But hey, if they see this video and they see you miraculously get up, they're top notch. They don't even have to continue on with their education. They're ready to go. If you notice something concerning about a student's performance, you can either fill out a pink sheet. We've also just been communicating that directly to myself, to Jim, Melinda, or Gabby. If you see anybody, any of the educators in the hall, and you want to let us know about an encounter that went really well, or an encounter, just say, can you watch this and make sure everything was okay? It's that simple, so we can address those issues. But again, if you see a student that might be taking this a little bit harder, or with this time of year, with seasonal depression, with anything that might be going on, we just want to make sure that the students are in a safe spot as well when they come into our lab. So if anything just seems off, just let us know. We will be happy to reiterate that to the faculty. Of course, you want to avoid discussing any student performance with any other SPs to maintain confidentiality and prevent any bias. With the 2 students you're going to be seeing that day, I don't know how much time you'll have to discuss or compare, but at least you know you're only seeing those 2 students. For one of you, I guess just 1 student. Thinking about the evaluation as a whole in the encounter. So as you're going through and filling out that evaluation, just be sure that you're taking it all into perspective and not just letting one thing like professionalism or physical exam kind of tank the entire evaluation. While that may need to be upped a little bit as far as the student performance, they can still excel in other areas, and we can still give them that credit and let them know that they're good in those areas. Here's some areas you might want to look at for your next encounter. And with this being such an early day event, if anything should pop up between after training today and tomorrow morning, let us know. I think we're on the slim pickings as far as extra SPs for this, because we do have this event and a PA event happening shortly after we finish this one. So there's going to be lots of moving parts that day. And if anything pops up that might affect your availability, please just let us know as soon as possible so we can get that taken care of. And then of course we have the event for this coming Friday. So December 6th, we'll have you arrive here at 7:30 in the morning. We'll have the 2 tiers at 8 and 9, of course, in the simulation center, and you are Sam Davis. So any questions about anything that we have talked about in our training thus far? Yes, Nancy.
So, because this is kind of a hospital,
The
they
rehab.
would be more likely to be wearing scrubs versus a white coat.
Oh, for them.
OTD doesn't tend to wear white coats for their things. So yes, they'll be in more of a clinic attire. So really what I'm wearing is more what you'll probably see them come in. And I know DPT, that's what they tend to wear as well, but they do have their white coats because they have the students ask about taking them off. But OT, I don't think I've seen an event yet where they've had students wear white coats.
So a big thing, at least with that, is that professionalism is half of that is showing up and being ready to go. But they'll, just like Dr. Pluchek was kind of dressed in his video, I would imagine a lot of khakis and tucked in shirts or blouses and pants, because they're going to have to move around as well. And if something is too tight or isn't coming off professionally, they would want to present that to the patient. So
I was thinking like, and even I've seen gals come in with higher heels. And if there's a chance that they have to catch me falling off of a bed, I don't want them in high heels.
I will tell you, their faculty are the one that check them in. So they do see what they all are wearing. So hopefully they will address that if it's a concern.
But let's go ahead and take just one more little break. Dr. Pluchek should be coming in here. So if you need to.
And I'll get a
use the restroom
video
again.
pulled up for you to watch.
Oh, I'm sorry.
Yeah. My arm, just FYI, it's the surgery arm.
Oh, so for you, it's not your good arm.
6 months later. Right. This is gonna be like a series in 6 weeks. We're gonna be like.
I don't know.
What?
Are they gonna have a follow-up
Can you raise?
event in the spring for this case?
No.
No? Okay.
Nope.
One and done.
I'm gonna be careful not to move this too. so
Well,
that's
maybe
really-
OTD.
when it's right.
Won't be involved.
Easier to screen.
We are. Oh, stroke
Picture
victim.
is
Oh.
because you'll, you're seeing.
I would love to see.
Oh, thanks for doing this.
I mean, they have other cases that involve similar things, but it's not a follow-up
No,
to the
don't worry
same
about it.
patient.
Saying, for the
I
ER, I
need
think
to
probably
work
OT
on
would
it,
not be
'cause
there.
that's part of my physical therapy.
No.
I don't know that they would have you.
Yes.
both
Of course,
together.
sure.
That's doing
I
both
was
together.
hoping somebody would say, oh, I need a
Where do you
coffee with
wanna-
2 spoons of
Above your
vanilla and 3 sugars and.
The non-fat mocha, Kappa Frappuccino.
I was telling these guys, I don't go to Starbucks. I
So
simply
for
don't know the lingo, but I
you,
do
if
know
they-
someone,
if this
she
is
has
your-
14
If
different.
this is your 100% on your right
And
arm.
her boot stuff is so
So then
good,
this needs
they-
to be
they
down
got it
here.
down.
Well, I don't know.
Oh,
She doesn't
yeah.
even write it down. She just goes, okay.
That's it.
How?
Cause they said that if
That
it's, you
person
have
should
to
be
do
an
like
SP.
what's normal for you,
Well, the,
so
the
if
big
I
trends
go
that
like
are going around
this, like
is
go like that,
people's crazy
it would only be like
sugary
that.
Dunkin'
Yeah.
donuts orders, and so it'll be like
It's
14
kinda gonna throw them off,
grams
I
of
bet.
sugar, sugar,
Oh,
5
my.
pumps of caramel, and all that fun stuff. Gosh.
Tell that to Kim, next time they recruit SPs, go to the Starbucks. Those are the people who memorize those.
Absolutely. I like the joke. Hey, it's been a while. How are you? Doing well. Any questions? We're just on a little break right now, so once they come back, we'll we'll put you on the spot and get you those questions into.
Alex, gonna be here. Alex,
Yeah.
since I have a shoulder on the right side that's not all the way up, is that gonna throw them off if I only go to here?
I think you can indicate to the student that you've had problems with your right shoulder. I wouldn't say surgery, but since you haven't had any surgeries in your
That's
character.
Could she
So-
hurt it in her fall?
I bounce from my left side to my right side.
I hit the
Help me
table on
get
the
up,
right
cause I
side.
can't move either way.
You can say that and just say my right side has nothing in this case, or has nothing to do with the case, so
Okay.
the student won't consider that.
Thank you, I just didn't want them to think I was strange.
No, you're good there.
What's your birthday, Sam?
Yeah, and all the tests are left sided too.
Wonderful, I'm just going to.
That's like, yeah, and then later it was.
Yeah, she was just kind of like, yeah, this, you know.
So is he actually coming up?
Yeah, he's got a drape on him.
Well, these new drapes are like twice as long, so they'll be really big.
Yes. Yes, it'll definitely go over top of the table.
Oh, this footrest is.
And like I said, we'll make sure this time the end is up. I'm not sure why it wasn't last year.
I think with OT, they would use the leg extension more than others, you know?
Well, since you're supposed to be in a bed in a rehabilitation center, we will have the leg extension up so that you have the full length to lay on.
So should they be raising us up?
Probably not, just for what they're doing.
Okay.
So here's a question that we have.
I think it comes out of my mouth.
Did they have surgery?
No, I think they don't. Or they probably don't.
It's just casted, yeah. I need to bring those up. I was gonna bring them up this afternoon.
And then I'm glad that we get to go into the lounge and do our.
Are they?
We don't use those computers.
It's not on the practicum, but I told them they should be washing their hands before.
I was gonna do it
It's not
anyway.
something I'm grading them on, but they should be, yeah.
Not even forehead, and they said, they'll slowly go to your regain.
And then the last
Now,
question we
but
had
forehead
was,
is hit.
when you're
Months from
doing
now, but you'll get it
things
back.
with your left
They
arm,
actually stimulated during surgery.
do you
It does work.
need
It's
to
just that
need your
it's
shoulder?
softened. Means
We saw a video of
Forehead,
I'm
head,
like,
back,
"Oh,
all
that's
that stuff.
Wow.
Because I had.
Just, they don't have to like Jimmy, as long as they just go like a little bit, yeah, the test is a 2 out of 5.
Uh-huh.
Is what I'm hoping to get at, so just a little bit of motion, I think Emily kind of played it up a little bit when she did that. But you can just, as long as they just go up a little bit.
Okay. Are we talking about?
Yeah,
Do everything
Talking out of one side.
normal, see what your normal is, and then past that.
yeah, yes, exactly, that's all I'm really looking for.
Okay.
And someone else adopted the sibling.
No,
Whatever.
Say pages.
Oh, okay. I didn't have a brother or sister, it was just two children.
The same area.
This anguish, dying to know what's going on, but they don't wanna ask. Where the other one was going. And then one of my friends, just, she has no problem with that. She says, Lynn, what is wrong with your face?
That doesn't sound good.
Oh. That's all I can explain.
I'm not so sure about that romantic part either.
Mike, he had 2 strokes. Why, Mike?
Oh, no.
He was
such a
used,
young man.
well, that was like maybe 10 years ago.
Wanted to
But he had a hole in his heart, they found.
She was.
And so a blood clot went up the wrong way and it got up to his brain. So they had to sew up, block the.
Yeah. Yeah, some people are like.
But yeah, it was.
Comfortable with who I am. Don't need to.
Oh yeah, he didn't have any after
Others
effects.
are like, I have no idea who I am without knowing this person.
Yeah, so- I know. Super scary. I don't
Yeah.
know. I don't think so, because they didn't say for anybody to
Well,
get
some
checked.
kids, some kids wanna do that.
Yeah.
It was fortunate that
Could we go?
it happened, I was home and, because he lost all, he could have been
Yeah.
driving or something.
I
Lost
think,
all sense of, just kind of like, well, the first time it happened, I knew there was something wrong, but he said no. He just kind of like fell down because he lost all, no,
It would be more culture.
all
right?
weakness is what I was trying to say.
Yeah.
And the second time, he had this slurred
Right.
speech and everything, and that's what I called it.
History.
He,
No.
right, he kept saying, always nothing, and so,
You'd think if he's such, if he's a long
Big city.
yeah.
over heart condition or.
Well, dogs
Yeah,
are.
and then, but I kept thinking in the back of my
companions.
wrong, but he's like, because he just, all of a sudden, it's just like
It's
it.
bad when you get tossed.
Something like he fell off a stick or something, and it
Yeah.
just fell down, and then he was fine, he's like, help me up, and I'm fine, and he was fine, he was walking.
No, but she might.
I'm
want
like,
somebody
let's go do,
to take care
go
of
to
the
the
dogs.
doctor.
All right, as soon as we have everyone in here, then Dr. Pluchek's gonna go over all of the simulations. So I think we're just missing. There we go. All right, so as soon as Justin's back in off the phone, we will get started. Real fast, answers to questions. I did get answers to questions. So you haven't had surgery on your wrist. The wrap is representing a cast. Since we can't cast you, the wrap is your cast. So think of it that way. That's why it is immobilized. That is your cast. And then for hand washing, so what you missed so far is the wrap is considered your cast. So think of it as your cast. So you haven't had wrist or hand surgery. And then they are not being graded on if they wash their hands, but they should wash their hands before working with somebody. So that if they don't wash their hands, that would be something you could comment on in professionalism, that you would feel more comfortable if they would wash their hands before working with you. But, if they don't wash their hands, don't make that go from a meets expectation to a below expectation. But definitely feel free to comment if they don't. And then last thing that you wanted me to ask about was engaging the arm. He said that Dr. Summerfield kind of overplayed that in the video. So just, whatever your movement would normally be. And like we talked about, we'll have you practice doing your full range and then just think about what your halfway range would be. So whatever your shoulder would normally do, that's what you're going to do. Now, since it is going to be harder, really, instead of thinking about, okay, how am I engaging my shoulders? Think about how you're engaging your face. Because when you are concentrating, trying to get something to do something that's not doing for you, really, that's going to be reflected more in your face. So it's going to be more of a, as you're looking at it and you're trying to will it to do more than what it's doing, that's going to be more here. All right, any other questions?
We're laying there, we're covered up, and these new drapes are really long.
Yep,
Are
and then
they
we have
going-
one in here.
Are they going to be taking that off of us, or do we have to try to kick out of it with one side?
That is a great question. That is a great question.
You don't have.
You could ask for help.
I know it all be on.
So, when you are laying on the table, one thing you can do if you want, you can leave it doubled. That might make it easier. instead of opening it all the way. And then when you're laying on the table, and you will have the pillow. I didn't bring one of those down here, but you know, if it's doubled, then it's not quite as much that you're dealing with. So I would do that.
They come in and say, sit up. So what do you do with all that?
So, you know, if you can, you should be able to lean on your right arm and use your right arm to get you up. Just remembering that your left is in a cast, so obviously and it's weaker, so you wouldn't be able to push up on the left arm, but you should be able to push up and use your right arm. Like I said, hopefully they're offering to help you with some of this too.
So
You
they don't
can
grab
ask
your
them to
left
help
hand.
you too. Like, I mean, I'm not grading on whether or not they're like able to get you up out of bed, but I think part of this is just to get them exposed to a patient and what it would look like and so if you are struggling, I would say, can you help me get up or something to that degree? And that then they should, and then I can make comments if they're not helping you when I'm grading. It's something that I'm not maybe taking points off because my focus is on the tests that are part of it, but it's also, I give feedback on those things because their sim in the spring is actually grading on those things.
And again, it's something you can comment on. That's part of professionalism. If they aren't offering help in maneuvering, you can make a comment that, you know, you would feel cared for if they would offer to help you sit up. So definitely things you can comment on. We did answer all the questions. I can get those to you later. All right, so what do you want to show them and have them know?
So all the students are going to have the same tests, except for maybe one of the tests will be different comparative to grip and pinch strength, just because of the amount of equipment we have. But when they come in, they should wash their hands, introduce themselves. Those kind of soft skills are kind of built in a little bit into the grading, but not much. The focus is more on the test itself. From there, they should sit you up. They shouldn't be last year we had some students having the person stand to do these things, but you can cue them and say, like, I'm too weak to stand right now or something to that degree, and have them do it at sitting at the side of the bed. That was one thing I think from last year that the students struggled with, is they couldn't figure out how to do things just sitting, which is actually very interesting to me. But yeah, so some of them had people standing and kind of, you know, turning around. So I want them to really focus on, this is a patient who would have weakness, so you wouldn't just leave them standing without like any assistance. So, but yeah, so you can get them up sitting to the side of the bed, or they'll get you up sitting to the side of the bed is my guess. And they'll just you can ask them to help scoot over to the side. And then from there, they're going to ask you probably a couple questions, just the basic history form. So, you know, history of hypertension, you fell, had a stroke about a week ago, fell and broke your wrist, and you have a cast on the wrist. So very basic. They'll ask a couple questions just about your home environment. You know, just do you live in a house, apartment? Do you have any stairs within the home? It's a very basic interview. It's just to get them starting to think about, because we go over interview process and the full evaluation in the spring semester. So that's not really the premise behind this. The premise behind this is being able to do the actual tests. So they'll just ask, it should be a short, brief interview, maybe a couple minutes. Okay. And then from there, they will go into doing what's called an upper extremity screen. So that's just a quick screen to see how your upper extremities are moving. So the left side is the weak side. So if your full range of motion for like the shoulder is all the way up to the head, just go about halfway. If you're a little bit less, a little bit more, it's totally fine. Okay. If it's when they ask you to go forward, you go about halfway. So come up to about halfway. And they're going to ask you to do it with both arms. So if your other arm is affected, that's totally fine. But just focus, make sure that left side stays at about halfway.
And again, this is half of your normal.
Yeah.
So that's why it's written the way it is on the back page of the script. We made sure to write it as your normal. It's half of your normal.
Yeah. So the test itself, as long as you have some motion, It doesn't matter if it's 25%, 50%, or 75%, it's still graded at the same level, okay? The test that we're doing for manual muscle testing. So if it's a little bit less than 50, if it's a little bit more, as long as it's not fully all the way up and not fully and not moving at all, okay? Somewhere in between there is completely fine. So they're gonna ask you to do the screen. So it's gonna be straightforward. So it'll look like this, back down, out to the side. They might ask you, can you go any further? And you'll be like, I'm trying, but I
And
can't.
that's where get your face involved in.
Yeah, yeah.
Shoulder raise.
Yeah, exactly. And then they'll ask you to touch your shoulders. So like this. So bend your elbow to touch your shoulders. You're like, I'm trying. Okay. Come back down. They'll probably ask you to touch the back of your head. So you just kind of, touch your low back. And then they'll probably ask you wrist up, wrist down.
And
So
remember, your wrist is immobile. I was bending mine without
Yeah.
even thinking about it, but you
Yeah.
don't have the wrap to help.
So
you.
you'll have the wrap. So they should say for the wrist, just do the right side. So don't focus because you have the cast on. Don't do the left side. If they prompt you to do it, that's when you say, I can't, it hurts too much. Yeah. Okay. So that you can prompt them. If they push you through it or if they take off the cast, that's an automatic fail for them. So
If they go to take it off, just tell them that's a cast.
yeah, the doctor told me to leave that on or something to that. They should not do that. I've trained them hopefully to not do that, but who knows? Sometimes you get things happen. So anyway, yeah. And then they'll probably ask you to touch every one of your fingers to your thumb. So you can kind of, that one's fine. If you do like the full range with the hand is, you can just go a little bit slower.
And really, if your wrist is hurting, just think about you're moving it slightly, but it doesn't quite get there on the left hand.
So that's the screen. So that's just a quick screen for them to do. And then they have 6 tests that they'll have to do. And all of them should have the same test, except for the final one will be a little bit different just because we only have 8 dynamometers or the pieces of equipment to test your grip. So some of them will do grip strength, some of them might do pinch strength, but the first 5 tests are all the same for every student. So they will ask you to bring your shoulder out to the side and overhead. So the left shoulder, not the right. So it'll just be one side. And so you just go about halfway. They'll have a goniometer. It'll look a lot bigger than this, but it's just this little thing. They'll be kind of behind you and measuring. It'll be a lot bigger than this. I don't just have my wrist one with me today, but they're just going to be measuring that range of motion.
Would they tell us what that number is or?
They
no?
have to say it out loud because I can't see it on the camera. So they have to say it out loud. So they'll say, okay, we got about 90 degrees here. So, so that's the first test. Very quick, very easy. Next one is going to be that elbow flexion. So bending the elbow. So you just come up to about halfway here. And then same thing. They're just going to be, have that off to the side here and measure it. And then they'll say, okay, I got about 50 degrees. They do have to show the goniometer to the camera because I can't see it on the camera. So that's one thing, a little caveat about this. So don't get weirded out when they're doing this in the chair. They're actually showing it to
I
the
would
camera.
tell them to go for the wall camera.
The wall camera?
Yeah, because that'll make it closer for you.
Okay.
Because it's
Okay.
down, lower instead
Yeah,
of.
okay. Yeah, I'll tell them to go off to the wall camera. Yeah. So they are verbalizing some of the things mostly because I can't see the small numbers on this. So it might sound like they're talking a little too much about the test itself. That's just for their grading because I need to be able to know that they're doing it appropriately. Okay. So if they use like medical terms where they're saying, I'm putting the goniometer on the humerus and the midway through the forearm, that's only for me. That's not for, so don't downgrade
So
them
just
on
like
that.
normal, if they're talking directly to you, they should be defining medical terms. If they're just talking out loud, know that it's for the camera.
Yep.
Doctor, question, if they were explaining it to me as a patient,
Uh-huh.
what would that sound like?
So for shoulder, the first one, I usually say it's like doing a jumping jack. So our goal for doing the jumping jack is to get your arm all the way up towards the ceiling. So you're up at about halfway right now. That's how I would describe it. So our goal is to get up all the way overhead. So that's about 180 degrees. We're at about 90, which is halfway. Yep. Next one, same with the elbow. Our goal is to be able to touch our shoulder when we bend our elbow. And so you got about 60 degrees. So our goal is to get about 150 degrees with this. You got about 90 degrees. So you got a little ways to go. So they should say like that's usually due to muscle. In this case, that's muscle weakness. It could be stiffness if you had a fracture or something to that degree. In this case, it's due to weakness. Yeah. So they might describe it as, oh, it looks like you have some weakness in that arm. Can you go any further? And you can just say, no, this is as far as I can go. I'm trying. Yes. Last one for the goniometer is hip. So if they are looking at it, they might have you do this one first just because you're laying down. And the test is done laying down. So if they want to be efficient, they would just do this one laying down. My guess is they probably won't catch it right away, so they'll have you kind of lay back down. Unfortunately, that's just the way the test goes. So with this one, it's hip flexion. So the goal is to bring the knee kind of up towards the chest. So about halfway is just about there. So just kind of bend your knee. So full range of motion would be kind of bringing the knee all the way like that. So our goal is at the hip, not at the knee. So just a reminder with this one, the goal is not really at the knee. The goal is actually at the hip. So you can kind of just bring it to about here and just say, that's about as far as I can go. And so they'll have the measurement if it was on the right side, it would just look like that. Goniometer is going to be on the side, on the left side here.
And that one, since you're straining, you could kind of bounce your leg a little bit.
Yeah, that's totally fine. Yep. As long as you get it up, our goal really is just to get it up as much as we can. That's our goal, but just not all the way up towards the chest. Okay. So if you think about how your hip goes to about 120, 130 degrees is right about here. Halfway would be about right here. As long as you get some between, I'm totally fine with it. If you're at 25%, 50%, that's fine. Even if it's 60, 70%, that's totally fine. Just no movement, not all the way to your chest. Okay. I don't even think I could get to my chest, to be honest. Okay.
Should we be straining to move?
Yeah, you can strain. They'll probably ask you, can you go any further? And you're like, oh, I'm trying my best. And you kind of strain with your face a little bit. But that's as far as I can go.
That's where I said, if you show it on your face and you kind of have your leg bouncing a little, what I'm finding works is I'm actually engaging my muscles under here to stop it from going any farther. And that's actually what's making it bounce a little bit because I'm got that tense. I'm trying to go, but I can't.
Yeah.
And I'm making it where I can't.
Yeah.
Is there a knee one also that I'm afraid that I might have my knee bent too far on for the hip one
to do the full hip range of motion, you actually bend the knee all the way.
Okay.
So even if the focus is on the hip joint itself. If you come up to here and you end up bending your knee and do that, that's fine.
But will they ever just have one where you're just measuring the knee only?
Not that is a possibility. That's part of their list that they could do, but I didn't give it to them. So
Okay, because I was afraid I'd move it too far on the hip one.
Oh yeah, I see what you're saying.
No, it's fine for the hip one, but it's not for the knee one.
I see what you're saying. Yeah, don't worry about that. The knee is not part of their test. It's the shoulder, elbow, hip, and then another shoulder, and then grip strength. Okay. So next one, they would have you. Let's see. I would have you sitting up here. And again, these tests, they're written. These are the tests by the textbook. in real practice, a lot of times we wouldn't be like turning people back and forth like this just because they would be too weak. So we'd like to teach them the textbook way to do it, and then they can cut corners later, right? So next one is shoulder flexion. So we're measuring muscle strength. So that the first 3 tests are muscle or joint motion. So just the amount of movement that they could get. The next 3 are focused on the strength itself. Okay. So to get full strength, they have to go through the full range of motion. So your goal here, they're going to ask you, what are we doing? Flexion. Okay. So you're going to come forward, thumb up, and I want you to lift your arm all the way over your head, but you're only going to go about halfway. Okay. So what that's going to do is that's going to prompt them to have you lay on your side, on your right side, to be able to do this. I'm hoping they will look at their tests and do the hip right after that. So then they don't have to put you on your side, come back up, put you back on your side. But if that's possible, if that happens, it happens. Okay.
And that's where your physical exam organization could have a comment.
Yeah, exactly. So that would be something where you make a comment like, I had to get up and go back down. I wish you would have like done the hip and the shoulder all at the same time.
You could easily say, it wore me out to have to sit up and lay down multiple times.
Yeah, yeah. Because they've already had one practicum, but with a partner, with a student partner, not in sim, but so they should be working on efficiency as well. So part of it is working on that efficiency. But so after they do the range of motion again, the goal here is you're laying on your side, which is a gravity eliminated position. So you don't have gravity kind of pulling you down. So usually you have a little bit better strength. So they're going to ask you, okay, I want you to lift that arm forward towards your face again and go about halfway is totally fine. They're going to say out loud, I'm palpating the deltoid muscle right now when I'm doing this. And that's for me, not for you. You could ask them, what's the deltoid muscle? You could say, and then they should say, it's the shoulder muscle right here. If you want to mess with them. I don't mind that.
And again, I'm offering myself resistance as I do it.
Yeah.
So.
Yeah. Okay. So that's the shoulder one. The next one is hip. So it's left hip flexion. So they would have you sitting up again, but they could combine those two. So they could do the first one, just the range of motion, and then the hip range of motion right off the bat, and then put you on the side, because this one you'll go back on your side and then do those tests back to back. I'm hoping that's what they do, because that's being efficient, but I'm not going to downgrade them if they don't. But I would like to see the feedback and just say could have been more efficient, because you had me going back and forth a lot. So with this one, knee, you're trying to bring the knee up towards the chest, so about halfway, just get it up a little off the bench. Okay, so I'm probably going to hold you here. Bring that knee up off the mat. Good. Okay. Any further?
I can't.
No? Okay. We're going to put you back on your side here. And this is, see, if we could have done the two together, right? But same thing here. Our goal is to bring that knee up towards the chest, just like we did, but on the side. They should be holding onto your leg like this. Just go about halfway. Just don't bring it all the way up to the chest.
Do we go a little bit more? Cause you said it's 0 gravity.
That's totally fine. Yeah, since you're in a gravity eliminated position, usually people get a little bit more range of motion on the side like this. But if you don't remember to do that, as long as you move it somewhat, it's still going to be the same grade of test. So as long as they get some motion, it's still a 2 out of 5.
And really, I did different there, because when you're sitting, you're already in a 90 degree. So to lift it up, you're going a little bit past. But this way, since I was starting farther down, I kind of gauged it as halfway.
Yeah. So as long as you just get some motion, it'll be a 2 out of 5. Okay. Last one is sitting up. And I don't have a dynamometer with me right now, but it just looks like a grip gauge. Okay. So it might either be the grip gauge or a pinch. Okay. So it just depends. We only have 8 of the grip. So we're not going to have enough for all the rooms. So it's either the grip or they have to do.
So if you haven't used these, the grip, it looks like a handlebar that you're pulling that has a meter on the top. So they just have you squeezing it, and the pinch has a little plate that you're pinching this way, and it's got a little dial that's giving them the information. So it's either gonna be something you're pinching this way or something you're squeezing this way.
And so the pinch test that they're doing, it's not this one, it's this one here.
It's any type of pinching is how it's.
Yeah, and they'll describe it to you. So the grip one, you're just making a grip. So their test sheet says both. So they have to know to not do it on the left side, okay? Because you have the fractured wrist. So if they try to do it on the left side to say it hurts too much, I don't want to do it. Yeah. So just the right side, and since your right side's not weak, just squeeze it as hard as you can. It's totally fine. Okay. Same one with the pinch. You shouldn't be doing it on the left side. So if they try to do that pinch gauge on the left, you just say it hurts too much. I'm not supposed to do that, or something to that degree. And just do it on the right, and you can do full since your right side is fine. That's all the tests. Yep. Hopefully they'll get you back laying down and put the drape back over you. That's another thing that they should be doing. If they don't, please make a comment about that. And they should kind of quick summarize and leave the room.
To make sure, we can't make a fist, we can't pinch, or we can't grip. But if they ask us to do this thing on the left hand, do we say it's too
You can do
painful?
that.
We can do
Yeah,
Well,
that.
and that's why I was saying that, you know, if you just act like you're working on it and maybe
Yeah.
not go all the way. Cause it's different, you're engaging, if you feel it, when you're doing this, you're engaging different muscles than when you are pinching something. So
Yeah.
if you're pinching something or gripping something, that's engaging muscles here. Whereas this is engaging more muscles that are here.
I did break my left wrist and I couldn't touch my fingers for months, not in a week. There's
There you
no way
go.
I couldn't have done it.
Yeah, so
try.
you can try to do it. You can try to do it for the range of motion, because that helps with the swelling. Like in a normal setting, that was my practice setting as hand therapy. So you usually can like do a little bit of range of, you just can't do resisted activity. So like the dynamometer, the grip strength, that's resisted. So that's technically strengthening. And so that's usually contraindicated at this early on. So not until about 6 weeks is when you'd be able to, but you would be able to kind of wiggle your fingers or touch your thumb. Maybe not get all the way to the thumb, but you could at least try to.
Okay. So one thing I would think about with anything on the left, you're really having to think about it. So make those motions slow, like you're really thinking about it. And definitely if you engage your muscles, it gives you that resistance that you get more of that slow motion trying to get to the halfway points. So just with every one of them, don't do fast stuff. Really, you know.
Yeah. You don't have to take like super long, but yeah, like it's gonna be a little bit delayed and slower. Yeah. Yeah.
Would a patient with this much weakness be able to walk unassisted?
Probably not unassisted, no. And that's why they should be doing it all seated.
Yeah.
And then,
I just wondered if they asked, how are you?
yeah.
Okay.
This would be something where if we were to get you up, they would put a gait belt on you, get the wheelchair, have a walker, just making sure. We'd have we'd have a platform walker, because you can't put weight through a broken wrist. But yeah, they shouldn't be there's no reason to get you up. Everything should be just seated, and then they can get you back down.
If they try to have you stand, just say, you know, they told me I shouldn't stand without some people here to help me.
Mainly just curious.
No, that's a good question. Yeah, so the premise behind this class is all motion, like movement and motor disorder type evaluation techniques. And then next semester is when they start to learn on like how to do transfers, how to get people up, like walking, how to get people up into the wheelchair, get them up to the sink to be able to do their self-cares. So we assess that in the spring. So this is really all focus on the motions itself, muscle strength, palpation of the muscles, being able to do the goniometry, which checks the amount of movement you have in those joints. So, yeah. Any other questions? I think it'll help too, because I last year I had different tests for different students, but This year, I wanted to make sure that it was more standardized, so every student had the same test. So they're all pretty, all the tests we just went through are the ones that they should be doing.
Question to Ellen's comment. So would the patient be immobilized or at least walking with assistance in that week as far as being in the hospital? Could they say that if the student were to ask, like, have you walked in this last week?
Yeah, you can say, yeah, they got me up like with a walker or with one of those walkers or something to that degree. Normally, yeah, usually about within like 2-3 days tops, you're up and moving, at least getting up, sitting upright, maybe not up walking, dependent upon the amount of weakness, something to this degree, probably within like 2 to 3 days after the stroke, unless you had ICU or had some type of more medically complexity. Yeah. But you could say that, like, they had me up walking or had me just standing with like a walker or something to that degree if they ask. Yeah. But they should, there's no walker in the room. They don't have a gait belt. There's no reason that they should be getting you up and letting you just stand with unassisted. But it happened last year, so I wouldn't doubt it. It might happen this year, but you could just prompt them and just say, I don't feel comfortable standing to do that. Can I just do it sitting? Anything else? I appreciate everybody. Thank you so much for doing this.
How long is the OT program? Is it a 2-year?
It's 3. Yep, just like it's similar as far as length with the PT program. So they start in the fall and then they graduate in May of following about 2 3/4 of a year.
Okay.
Yeah. Yeah.
So yes, this year we have second-year students.
Yep.
Next year we'll have third-year students added on.
Yeah. So our first cohort graduates in 2026. Yeah. So we're excited. Yeah. Yeah. Thank you so much. Appreciate it.
Thank you.
Yeah. All right, so Alec gets himself signed back in. Quick thing, since you will be in bed with the gown, I believe we have the gown on you. Gowns and robes and drapes are all in the cabinets now in the room. So if you haven't been here recently, the skinny cabinet where you put coats and things, cabinet right above that. You will find in every room 2 sets, because when we have mentor-mentees and standbys, making sure that there's 2 sets in every room so that everybody can find something to wear. So they are stacked up actually in a pile, and the pile will look like that. So the very bottom one, since I know it's one that we really don't have any SPs that need a 5XL.
Oh, no, it's after Thanksgiving.
You know, if any of you ate that much, I think you're gonna need more help than what we have here.
But you pick what you feel most comfortable in.
Just remember, you're maneuvering on the table, so don't pick too big or else you're gonna have a lot to try and maneuver. Because really your goal with anything that you put on, and I said this at a couple of the last things, and I saw light bulbs come on for people. Think about your hospital gowns. They're meant to meet in the back. You just don't want it gaping wide open. Hospital gowns are not meant to wrap completely around you like a robe. And if it's so big that it wraps completely around you, you're gonna have a hard time with any event trying to get it out from under you to where it can be maneuvered. So I'm trying to think of your comfort here, trying to maneuver things. And then you always just make sure that it's just the top that's tied. Because for most events, students will need access to your back, and having bottoms tied makes it harder for them to get to stuff and takes more time to have to undo that one. So just have the top tied, and you want the top tied at a point where you can't just pull all the way down and have your chest fully exposed. Because part of what we do is get students comfortable with either hopefully offering help with untying and retying things if they're needing things maneuvered. OT will not need that for this one, but also making it where, you know, they can feel comfortable touching a patient and things like that. So that's why we tie things tight. Your gown shouldn't be where, you know, you can maneuver the whole thing and pull it off and pull it back on and wrap it around yourself multiple times. So just think about that as you grab things. You want it to cover you, but you don't want to make it so hard that you have a hard time maneuvering. Because that gets awkward when you're sitting there like this the whole time. But again, all of these are in the exam rooms, and eventually I'm going to have signs in there to remind people of sizes. That would be the smalls like we had before. So if you're small, the blue pattern is your, they just call it regular, but compared to our old ones, this would be your medium to an extra large. Then the green one would be a bigger extra large to like your 2, 3X. We've never had 5X. The biggest we had before was 3X. So I have found that everybody who wore even up to a 3X before has been comfortable in that one. So those are your sizes, and they are all stacked up in a nice little pile in the cabinets.
Is there any reason to even put the 5X in there and take up space? I mean, if
I actually don't have that one doubled. I just have one in there in case somebody really feels that they want it. But they are all stacked, and I adjusted all the shelves so there is space. And one other thing, if you have trouble reaching anything, just know that every room does have a step stool under the sink area. And they are very sturdy because they're meant for the DPT students, use those a lot in their things. So you're more than welcome to pull that out and step on that to reach things in the cabinet if you need to.
And we'll also be around if you have any issues with that, we can definitely come into your room and help out as well.
Yep.
And
then I'll come back to you.
This is kind of unrelated, but I wanted to ask, so I make sure I'm doing it right. As far as cleaning the room, what is the expectation after each patient or after?
That's a good question. So I'll come back to that one in just a second.
Okay.
I was gonna ask about the extra drape. Okay, if we want a second one, do we need to come and ask you?
No, you can pull one because like I said, there are 2 sets of everything in the rooms.
Okay, perfect.
So
Okay.
if you want, yeah, you can for your 2 things, have that there. Just know that with that, when you sit up, it may swivel with you. So just be aware of where your legs are. I don't want to have anyone trying to lift things and be tangled in it. So just keep yourself aware of where things are. But yeah, like I said, for this, since these are huge, just leave them in half to do either bottom and or top. Half will be more than enough. Don't unfurl the whole mast. So that is good question for the drape. Now for cleaning, great question. At the end of each event, whoever is the last in the room, because I know sometimes we have standbys. So if a standby is in your room on the last tier and you aren't here anymore, then the standby will do this. But we do have wipes in the lounge, and if we don't have them out, remind us, we'll get them out. They're typically under one of the cabinets by the sink. Just grab one wipe, and all you need to do is wipe off the exam table. And if the students have used a stool, I don't know if they will for this one, just wipe off the stool. You guys won't be using the chairs unless we aren't going to have you type in there. So you won't need to wipe off the chairs. So typically it's whatever has been sat on is what you're wiping off. So wiping off the exam table, wiping off the stool, and then like the arms of the chairs and stuff are what you're wiping off.
What about the pillow?
And pillow. Thank you. I forgot about the pillow. Yes. And then wiping both sides of the pillow. So that's why we have you stand the pillow up. You can either stand it upright and lean it against the wall or on its side lean against the wall. Because if you plop it back down, it stays wet under the pillow for a very, very long time. So just put it on its side somehow, standing lengthwise or sideways, leaning against the wall. And that way it allows the pillow to fully dry and allows the table to fully dry. And then we also know that it's been cleaned. And then we will have the cart in the room in the lounge for you to put your drapes and your gowns in. And if you're using robes as well. Any other questions? These are good ones. All right, so keep in mind, as Dave said, they did change this a little bit from last year, but it'll give you a little bit of an idea of how it works. And since it is a little longer encounter, we won't play the whole thing. We'll just let you hear kind of how they get started and then skip forward to the end so you can hear a little bit more of how they are ending, wrapping up. Since we did go over all the exams in depth for what they're expected this year.